What is depression? Today we'll discuss depression, one of the earliest mental disorders. If you want more videos on psychology and mental disorders, give us a thumbs up, subscribe to our channel, and let us know in the comments. Depression. Some people use this word so easily that it becomes an essential yet unconscious part of their daily language. We might even say as a joke, "Leave me alone, I'm depressed," when we don't really mean it. Yet sometimes it's not a joke at all. The good thing is that such teasing helps to spread awareness of one of the major 21st century disorders. Nevertheless, people start to neglect depression, thinking it is a minor disease not worthy of attention. So today we will find out what depression is, in its essence, what causes it, what types of depression exist, and how to help if your close ones suffer from this disorder. Depression is a major mental disorder characterized by pervasive low mood, moderate inhibition, and impaired thinking. The symptoms of depression are weakness, easy crying, apathy, isolation, hopelessness, irritability, negative thoughts, lack of appetite, insomnia or hypersomnia, and many others. Coping with depression, one may see diverse specialists: psychiatrist, psychotherapist, or clinical psychologist, since each of them deals with different types of depression. Depression is an overwhelming, exhausting, and devastating disorder no one is safe from. Age, physical health, the marital or social status might be of no importance when talking about depression. Anyone can suffer from it. Depression affects each and every process in the body and mind, emotions, physical and mental states. A depressed person is subject to low mood, a sense of guilt, irritability, sleeping disorder, lack of energy, isolation, difficulties in decision-making, predominance of negative thoughts, and change in eating behavior. These symptoms have to last at least 2 weeks to diagnose depression. There's also a depressive triad, which refers to the 3 types of thoughts a person is subject to while in depression. These are negative views about self, world, and future. Like any other disease, depression includes several types. Endogenous depression is caused by genetic and biological factors and occurs for no apparent reason due to the presence of an internal stressor. There's a number of reasons for it. For example, personality traits, genetics, or lifestyle. Endogenous depression is really hard to cope with. The disorder makes it impossibly difficult for people suffering from it to socialize. Some struggle to accept such behavior because they feel there's no real reason to be depressed. Endogenous depression might be connected to more severe psychiatric disorders. Living in unhealthy, stressful, or dangerous environments, for instance, usually triggers them. The first-line approach includes sessions with a psychotherapist and medical treatment.
Stop crying. It'll be our little secret.
Exogenous depression occurs in response to an external stressor when a traumatic event happens in a person's life. For example, a person might be overwhelmed by sadness, a sense of guilt, or feel worthless after a divorce, bereavement, loss of a job, and so on. The patients experience inhibited thinking, attention failure, and find it hard to concentrate. Patients don't always experience physical symptoms of depression, yet their mood is still low. They have difficulties with sleeping, their appetite changes. Psychogenic depression is always connected to a traumatic situation. Next one is dysthymia, or persistent depressive disorder. It is a mild form of depression, yet it lasts longer. It is still unclear what triggers dysthymia, but scientists believe it occurs due to chemical imbalance in the brain. External factors such as the environment also have an impact on the development of dysthymia. The symptoms of dysthymia are the following: lasting low, anxious mood, inhibition of thoughts and speech, difficulty falling asleep, low self-esteem, weakness. These symptoms have no clear manifestation, so a patient can live like a normal person, communicate with others, and respond adequately while feeling totally empty inside. Unlike other types of depression, dysthymia is not always accompanied by recurring thoughts about the gloomy and dark future. As a rule, patients conceal the traumatic situation. They grow accustomed to mild depressive symptoms, so they don't seek help. Dysthymia may follow other severe medical conditions or substance abuse or anxiety disorders. 2 or more years of depressed mood constitute a long-term disorder. If you experience something like this, consult a therapist.
I shouldn't be lining up for meds behind schizophrenics and sociopaths. It's Monday. I should be in school. But I guess that's what got me here in the first place.
Mass depression is one of the most intriguing types of depression, yet most of the representatives of the mental health field don't support it. It doesn't include typical signs of depression at all. Physical problems, somatic and vegetative disorders come to the fore. Mass depression might disguise itself in the form of headaches, back pain, abdominal pain, anorexia, bulimia, skin diseases, or phobias. It also affects the behavior. A depressed person might perform some deviant acts. A patient with mass depression focuses on bodily disorders and doesn't even think about depression. What do the symptoms of depression influence the body? There are several reasons. This type of depression is typical for big city dwellers. Their life is getting faster daily, so they cannot afford to show apathy, low mood, or tiredness. Moreover, many people think that depression doesn't exist. Low mood and apathy are explained by laziness. Missing out on life is not acceptable. People with such attitudes are likely to have a masked form of depression, which has an impact on their bodily systems. People may not have a clue about their mass depression. They might seem talkative, cheerful, productive, and successful, yet if a person has mood swings like never before, it is a wake-up call. Mass depression takes different forms. It is an invisible monster under the bed. A patient either doesn't consult the therapist or goes through a line of doctors before they figure out what is really happening and make a correct diagnosis. Somatic disorders give the patient a hard time, and they don't just go away. They increase irritability and anxiety, which make depression more severe. It is a tricky type of depression. The year 2017 witnessed the flash mob phase of depression. It aimed at showing that even if a person who always smiles, laughs, and lives actively might struggle with depression. Actually, depression is not the only disorder that is hard to diagnose. Learn more about them in our course, Clinical Psychology. A discount promo code and a link to the course are in the description box. The next type is postpartum depression. Even though it might affect both sexes, women suffer from it the most. They struggle to adapt for the new role and changes in the body. There's a number of causes for postpartum depression. First, a mother might not meet the expectations of the ideal mother, which will make her feel worthless. Moreover, the endocrine profile changes and influences the nervous system, and a woman gets more emotionally unstable. Bringing up children puts too much pressure on women. They lack time for rest and recovery, and these factors together trigger depression. The relationship with the partner also changes significantly. Lasting exhaustion, a lack of sleep might provoke fights, which will worsen the situation. And these are the signs of postpartum depression: irritability, insomnia or hypersomnia, mood swings, tearfulness, low mood. A woman feels worthless and out of place. She blames herself for not being able to manage her new duties and not loving a baby enough. She can cope with postpartum depression with the help of a psychotherapist or psychologist. However, moderate postpartum depression might also require medical treatment, and a patient in a severe form needs hospitalization. If a friend of yours suffers from depression and you want to help, the first thing to do is to speak to them. Remember, you are not a qualified psychotherapist, unless you are, so your main task is to support and not to worsen the situation. Find out what eats the person, what they're scared or worried about. Listen carefully, show that these problems are important for you. A depressed person needs to feel they are not alone, and their friends are ready to support them. Don't devalue fears and troubles that seem insignificant to you. Keep in mind that being a compassionate listener is more important than giving advice. Don't try to fix your friend. Once again, you're not a therapist. Sometimes a face-to-face conversation might help, but keep in mind that a single conversation is not enough. Depressed people tend to isolate themselves from others and find it difficult to express their feelings. What else can you do to make your friend feel better? Suggest spending more time outside as it alleviates mood. It is also good for health. A depressed person tries to spend more time isolated, so a blow of fresh air might be helpful. Try doing sports together and eat healthy. Mineral balance is important for the body. Uplifting activities will help the depressed feel more alive. Encourage your friend to seek professional help. The set measures are fine but not perfect. A depressed person usually lacks energy, so thinking about getting help could be extremely daunting. Sessions with a therapist or medical treatment are the essential steps in depression recovery. Do your best to help your friend to leave this state behind. One more time, there are certain phrases and actions that can worsen depression. For example, don't pity your friend. Support doesn't mean feeling pity. Pitying is a disgusting, discouraging feeling which will make people feel even more worthless and helpless. Depression is a severe disorder. Don't underestimate it. Treat it seriously and encourage your friend to undergo all the necessary treatment. If you spot the symptoms of depression in yourself or in your friends, don't hesitate to ask for help. Take care. If you want to know more about different disorders and their symptoms, join our course, Clinical Psychology. You'll get an insight into the different personality patterns, mental disorders, and how they manifest themselves. A discount promo code and a link to the course are in the description box. If you liked the video, give us a thumbs up, share with friends, and let us know what you think in the comments below.